क्या लगता है साफी एंड और द आयुर्वेदिक जो ब्लड प्यूरिफायर्स होते हैं वो कितना हेल्प करते हैं हमारे स्किन के लिए?
ये सारे ब्लड प्यूरिफायर्स वेस्ट ऑफ मनी होते हैं।
हार्मोनल एक्ने कम्स।
सो स्किन केयर उस टाइम पे भी बहुत इंपॉर्टेंट होता है फॉर टीनेजर्स। आई मीन लाइफस्टाइल डिक्टेट्स एवरीथिंग इन आवर लाइफ। लोग बोलते हैं नहीं बट वो तो नॉर्मल है या नॉर्मल लेवल ऑफ स्ट्रेस होता है।
हार्मोनल एक्ने हमें बहुत ज्यादा फ्लेयर अप ना करे।
तो जैसे हम बड़े होते हैं हम थोड़ा सा वो एक्सेप्ट भी करने लगते हैं। A lot of people have more of sugar that time, sometimes more of salty foods, whatever you're craving. So it's important to maintain the balance in your lifestyle and your diet and your exercise so that you can bring down that hormonal acne. Oils लगा लेंगे फेस पे, कुछ भी जो मिला वो लगा लिया, तो वो ग्लैंड को ब्लॉक कर देता है, फिर acne आ जाता है।
How good are
Genetics।
face washes which are available? Neem, Himalayas, Neem face wash, this Neem face wash. Do they help?
Face wash cannot just stop your acne.
So how can somebody understand their skin type? Okay, which skin type are they?
Yeah, so अगर आपका skin dry भी है तब भी acne हो सकता है and oily भी है तब भी acne हो सकता है।
And these days, Korean face masks and Korean products are very. How effective are those Korean products on our Indian skin?
That concept of Korean glass skin is a little far-fetched.
You said retinols, but I've heard that retinols don't suit everyone. Is it? हर किसी को अच्छा दिखना है, हर एक को चाहिए एकदम फ्लॉलेस स्किन। बट कैसे? क्या हमारी डाइट रिस्पॉन्सिबल है या अच्छे प्रोडक्ट्स यूज़ करने चाहिए या फिर जेनेटिक्स? सो लेट्स अंडरस्टैंड ऑल दिस अबाउट स्किन एंड हेयर विद डॉक्टर अनिका। शी इज़ अ डर्मेटोलॉजिस्ट and she will tell us everything about skin and hair. How can we take care of it and get flawless skin? So do watch till the end. And if you like the video, do hit the like button and subscribe to my channel. Hi, Dr. Anicka.
Hi.
Hey, you are into profession loved by all women. Everyone wants to look good. And why these days everyone is so conscious? What do you think?
You're right, but I think that's related a lot to do with the fact that there's so many treatments that are so easily available now, so the beauty standards have gone higher. I don't think there's anything wrong with that as long as you're confident and you kind of appreciate yourself and the way you look and don't
Yeah.
expect to look like someone else.
That's right. And so that's you talk about external treatments. What about gut health? Because these days we say that if your internal is good, that's what reflect outside.
I think something we have to understand is that the skin is the largest organ.
Right.
So what that means is anything you're putting on the inside, any internal health will also reflect on the outside. So a lot of times I as a dermatologist do get patients come into my clinic and say, okay, we have acne, we have pigmentation, but we do have to also look into the possible causes, including gut health. So with gut health, it's very important that you're eating a high fiber diet, you are having probiotics, because this will help balance out the good bacteria in your gut, which
Yeah.
in the long run will impact your absorption of nutrients, the hydration levels, everything is impacted because that's where the nutrients are absorbed from.
क्या लगता है साफी एंड और द आयुर्वेदिक जो ब्लड प्यूरिफायर्स होते हैं वो कितना हेल्प करते हैं हमारे स्किन के लिए?
ये सारे ब्लड प्यूरिफायर्स वेस्ट ऑफ मनी होते हैं। ऐसा
Okay.
कुछ नहीं है दैट ब्लड प्यूरिफायर पीने से आपका ब्लड साफ हो जाएगा, राइट? बिकॉज आपका लिवर डिटॉक्स करता है आपकी बॉडी को, द फूड यूर ईटिंग उससे फर्क पड़ता है। सो साफी पीने से आपका ब्लड डिटॉक्स नहीं हो सकता है। दिस इज जस्ट अ वेस्ट ऑफ मनी।
So teenagers से ही हमें hormonal acne as soon as girls reach puberty इतना ज़्यादा acne problem हो जाता है। सबका ऑयली स्किन हो जाता है या why this hormonal acne comes?
So basically due to hormonal change, sebum production increase होता है। So इससे हमारे oil glands stimulate होंगे, acne stimulate हो सकता है, but it's not actually that सबका oily skin हो जाता है। So ऐसा नहीं है। But
Right.
yes, because of hormonal changes during puberty, acne stimulate हो सकता है। A lot of stress from school, dietary changes, बहुत factors होते हैं, outdoor exposure, उस time पे हम इतना conscious नहीं होते about our skin. So skin care उस time पे भी बहुत important होता है for teenagers. And over time अगर just simple hormonal and hormonal changes की वजह से acne हो रहा है तो वो improve हो जाता है with age.
आई थिंक उस टाइम पे लाइफस्टाइल भी बहुत ज़्यादा चेंज होता है। लाइफस्टाइल का कितना रोल है? जंक फूड का हाउ मच इज़ द रोल यूज़ field
Lifestyle
in
is
acne and all.
everything. I mean, lifestyle dictates everything in our life, right? Whether
Yeah.
it's a predisposition to having diabetes, hypertension, other diseases. So lifestyle बहुत important होता है. And lifestyle means sleep habits, exercise habits, dietary habits. You know, so many factors are included in lifestyle.
Mm.
Recently, I was listening to an endocrinologist speaking about stress and the impact of stress. बहुत बार मैं पेशेंट से बात करती हूँ regarding stress also, because this is
Yes,
also
yes,
part
yes.
of our lifestyle, right?
Absolutely.
And लोग बोलते हैं नहीं but वो तो normal है या normal level of stress होता है. But हर चीज हमारी लाइफ में अगर छोटा भी स्ट्रेस होता है वो स्ट्रेस होता है, एंड उस टाइम
Yeah.
पे हॉर्मोन्स रिलीज होते हैं, कोर्टिसोल लेवल इंक्रीज हो सकता है, एंड उससे हमारा स्किन भी इम्पैक्ट होता है.
So stress से सबसे ज्यादा क्या होता है? रिंकल्स या एक्ने वो मुझे बहुत होने वाला है क्योंकि
स्ट्रेस से सब कुछ होता है, रिंकल्स एंड एक्ने.
राइट मतलब कि मतलब स्ट्रेस लेवल्स एक्चुअली आई फील दैट स्ट्रेस लेवल दीस डेज मेंटेन करना इट्स वेरी डिफिकल्ट है.
I think these days we've normalized stress,
यस.
right? So
या
अगर हम स्ट्रेस भी होते हैं वो हमें नॉर्मल लगता है,
नहीं.
एंड अगर आप किसी को फैमिली में भी पूछोगे दिल से अच्छा पर आपके तो बच्चे हैं तो स्ट्रेस तो होता ही है, as if it's normal,
As if
right?
it's
That if you
yeah.
have kids or if you have a demanding job that you should be stressed, but I don't think that's okay, right? Because अगर हम उसको normalize करते हैं then we don't try to work on it. So it's important to incorporate things in your life जो आपको अच्छा लगता है, जो आपको help करता है. Like some people enjoy certain activities like singing, dancing, exercise, you know, so many things. Meeting your friends, they help relieve that stress, and that's important.
Yeah, I agree. So if a teenager girl or even in the older times, मतलब जब हम बड़े हो रहे होते हैं, हर every period cycle we face acne and starting में 2-3 दिन पहले start हो जाते हैं and then हमारे खत्म होने के 2-3 दिन 4 दिन बाद मतलब वो महीने में 10 दिन तो हमारे को acne रहता ही है. So what we can do कि वो hormonal acne हमें बहुत ज़्यादा flare up ना करे या ना हो.
You know, again, a lot of times I try to explain this to younger girls as well, because जैसे जैसे हम बड़े होते हैं हम थोड़ा सा वो accept भी करने लगते हैं. जो younger होते हैं periods थोड़ा सा new concept होता है उनके लिए, maybe just few years since their period started, skin भी बहुत change होता है उस time पे, so it's harder to digest that आपको उस time पे acne आ सकता है. We can't maybe fully stop it, but the skincare routine, changing skincare routine according to how the skin is behaving. कुछ लोग मुझे ये भी बोलते हैं कि around periods skin एकदम से ज़्यादा oily होती है, so आप उसको उस according deal करो. So people think that एक बार प्रोडक्ट स्टार्ट किया तो वो लाइफ लॉन्ग वो यूज करना है, but that's not true, right? Our skin also changes, so according to skin changes आप अपने products भी change करो, lifestyle, diet. A lot of times we don't take this into consideration, but during periods we have more cravings as well because of the hormonal changes. A lot of people have more of sugar that time, sometimes more of salty foods, whatever you're craving. So it's important to maintain the balance in your lifestyle and your diet and your exercise so that you can bring down that hormonal acne.
या एंड कितना रोल है नीम फेस वॉश, हिमालय के नीम फेस वॉश आते हैं या ओवर द काउंटर्स जितने भी क्रीम्स आती हैं, लॉट ऑफ कंपनीज से एक्ने फ्री क्रीम्स और 3 स्टेप एक्ने रिमूवर, हाउ इफेक्टिव आर दोस?
You know, I think now the good thing is because of social media, Google, people are a little more aware of ingredients in their skincare. I do think that the formulation, apart from just the ingredient, but the product itself is important. So many times it can have all the hero ingredients like salicylic acid, lactic acid, anything you think of is there. But फिर भी वो आपके लिए काम नहीं करेगा. So number one is of course the ingredients, and that's where a dermatologist comes in, right? Because they know about good products, they know what would suit your skin type. So that's one, the skincare. The second is just that in general, like I don't think any one product will just cure you of acne. Some people do have acne because of products, like वो oils लगा लेंगे face पे, कुछ भी जो मिला वो लगा लिया, तो वो gland को block कर देता है, फिर acne आ जाता है, maybe sweating ज़्यादा होता है, skin का care ही नहीं करते, तो तब भी acne हो जाता है. But the point is that it's not just the 3-step skincare that will cure you of acne, it's everything. Like we spoke about lifestyle, diet, exercise, what you're applying as well.
How good are
Genetics.
face washes which are available? Neem, Himalayas, Neem face wash, this Neem face wash. Do they help?
Face wash basically has to be chosen according to your skin type. It really doesn't matter if you have acne and you're using a face wash that says, acne control. Nothing will
Mhm.
just, a face wash cannot just stop your acne. But
Right.
yes, of course, since there is an increase in sebum and salicylic acid helps to combat that,
Mhm.
using a salicylic acid based face wash would help acne to some extent. But it's
Yeah.
more than that. Sometimes the acne is so severe, so you need medication also. In clinic, treatments may be required. Lifestyle changes are required. Genetic factors play a role. Hormonal acne during
Mhm.
teenage years also can keep coming regardless of everything being perfect, but still आपको acne आता जाता है. And you just have to wait it out a bit and be a little patient because time के साथ वो improve भी हो जाता है.
And you just said clinical procedures. So, for acne, what all clinical procedures you have, which can be done to combat
There are
acne?
actually many procedures. So one is that when we're actually treating the acne directly, हम सिर्फ pimples पे काम कर रहे हैं. For example, peels हो गए, उसमें salicylic peels, combination peels with mandelic acid, also azelaic based peels. So according to how your skin is, so if your skin is very oily, then आप salicylic peels करा सकते हो. Black peels also great. So there are many different peels. They don't literally peel your skin.
Right.
वो दिस इज अ मिसकंसेप्शन बिकॉज ऑफ द नेम. हमें लगता है हमारी पूरी स्किन ही पील हो जाएगी, वैसा नहीं होता है. तो वो बेसिकली एक्ने को ड्राई कर देता है, मार्क्स को बेटर करता है, स्किन रिन्यूअल करता है, सो दैट न्यू स्किन कम्स, skin will start looking smoother, the acne will also start looking better. Apart from peels are the most basic.
Okay.
Apart from peels, you have options like Dermapen 4, जिसमें सब कुछ होता है, serums भी होता है, needling भी होता है, so जो pimples related marks, scars वो भी improve हो जाते हैं. There's carbon laser, wo bhi pimples ko bhi dry karta hai, skin tone improve karta hai. Because not only are there pimples, usually people have the acne along with marks and scars as well.
Yeah.
So we have
Right.
to treat everything.
And if somebody's don't know, okay, which skin type we have, so how can somebody understand their skin type? Okay, which skin type I am?
Yeah, so that's a good question. Skin type is quite easy to figure out. You just have to
Okay.
use a gentle cleanser,
Okay.
pat your face dry with a towel, leave your face for 30 minutes, and then just observe that is the T zone oily, so then you have a combination skin type. Do you feel like the whole face is shiny and oily, pores are looking big? So then it's an oily skin type. Normal just feels soft, smooth, supple, no major changes. Dry, it'll feel tight, flaky. And
Right.
sensitive will feel like itchy and rashy.
Okay. And do only oily face, मतलब जिनका oily face है, they only get pimples or the other people can also suffer from
Yeah,
pimples?
so it's that's an interesting question because I know we relate acne to oil,
Oily skin,
but
right.
ऐसा नहीं है. So basically any skin type can have acne. So अगर आपका skin dry भी है तब भी acne हो सकता है, and oily भी है तब भी acne हो सकता है. I actually think it's easier to treat someone who has oily skin with acne because जब dry होता है, a lot of the acne care products have salicylic acid जो और थोड़ा dry
और
कर
dry.
देता है. Yes.
एंड आई जस्ट शेयर विद यू दिस थिंग कि जब मैं अपने कॉलेज ड्यूरेशन में थी लाइक टीन्स आफ्टर टीन्स सो माय फेस में स्किन तो नज़र ही नहीं आता था देयर वाज होल पिंपल्स एंड एवरीथिंग एंड सो आई गॉट दैट फर्स्ट केमिकल पील डन एंड उसके बाद बहुत ज़्यादा मार्क्स थे एंड आई गॉट क्यू स्विच डन सो दैट एक्चुअली हेल्प्स बट पहले बहुत ऑयली स्किन था and now it has changed to dry and extremely dry or sensitive. Does that happen also? Matlab, with time, your skin type changes?
Yes, that definitely happens. So that was my point that जैसे जैसे हम age होते हैं, हमारी skin type change होती है, sebum production reduce होता है, body will get very dry as well as the face. So जब face oily है, वो और dry होता जाता है, but body तो वैसे भी थोड़ी dry रहती है when we're young as well. So वो तो और भी dry हो जाता है. So this is true that as we're aging, sebum production reduces, cell turnover reduces, which means जो dead skin cells होते हैं ऊपर के layers के वो इतने easily shed नहीं होते. So skin be dull लगती है. So as we're aging, these changes happen, and that's why in clinic procedures, skincare, these are very important to help maintain the cell renewal and just make the skin look fresher and glowier.
Yeah, and what's the effect of alcohol? Do alcohols also have effect on if somebody is drinking alcohol or smoking? Do that also have effect on skin?
Alcohol impacts everything, right? So alcohol dehydrates us. It can end up like with some liver damage. lot of impacts of alcohol on the skin as well. I won't say it's only alcohol on the skin that we have to be worried about. I think alcohol has so many detrimental effects on our whole body.
Yeah.
But yeah, in terms of skin, immediately, usually after you've had a night of heavy drinking, you'll have some dehydration, dullness, maybe accentuation of wrinkles, dark circles. So overall, yes, alcohol is not the best for your skin. A lot of times it can cause sugar spikes if you're having, sugary drinks with the alcohol, or if the food intake increases. A lot of people have a tendency of drinking and eating, which will also kind of, indirectly or directly impact the skin as well.
If somebody is getting every month periods, if somebody is getting acne, hormonal acne, do that every month you have to go for clinical procedures, or what we can do on a regular basis?
So I think now the trend is changing. You can anyways opt for once a month clinical procedures that help to kind of exfoliate and take off the dead layer of the skin, which we can't completely do at home. And that would also be preventative for the acne. But if you just want to treat it at home and you want like a quick fix, spot treatments work. So if you're getting acne, you can use adapalene based gels, you can use benzoyl peroxide, azelaic acid. These are great ingredients that would help to just, nip it in the bud right away and help prevent it from getting too big.
So that we can use on a regular basis.
Yes, that can be used on a regular basis.
And these days, Korean face masks and Korean products are very. How effective are those Korean products on our Indian skin?
So honestly, when patients come and say, "Hame Korean glass skin chahiye," I just ask that, do you have a Korean family, like, mother, father, grandparent? So of course, if you're not Korean, you can't have Korean glass skin, right? We have to look at genetics. We have to look at skin tone. They have a much fairer skin tone than an Indian skin.
Yes, right.
So अगर आप उसको ग्लो करा दोगे तो वो तो और luminous दिखेगा, because it's a very light and luminous tone to begin with. Right? Yeah. So I think that concept of Korean glass skin is a little far-fetched. But if you ask me about the products, they are great. They're very hydrating. They have many actives. So ऐसा नहीं है कि वो बिल्कुल waste of money होते हैं. But I think they're not required. Just the Korean skincare was all about 10 steps and so many different ingredients and products. Honestly, if I were to use it, I would get acne, right? Because they're very hydrating. A lot of times they have a glycerine base, which would not suit everyone. So अगर बहुत dry skin होती है, usually उनको बहुत अच्छे लगते हैं Korean products, क्योंकि बहुत सारे layers होते हैं, hydration होता है, so वो उनको suit करता है. But for a normal skin type or even acne skin type, maybe it might make the skin worse.
Okay. And there's one mucin gel is very that's what we can
trending right now.
Trending right now. That skin. What's that? Mucin gel,
yes,
right?
Snail mucin. Yes,
snail mucin. Yeah, snail mucin. So it's a snail mucin.
Yeah, it literally is snail mucin. It's mucus secreted by the snails, which are designed to protect them. So we always have that expression, slimy as a snail.
Yes.
So that mucin is designed to protect the snail, but we can use the benefits. So snail mucin actually has a lot of benefits, like hydration. It can help in anti-aging. So it does have those benefits. It even has antioxidant and anti-inflammatory properties. But if you ask me, is it essential or required in a routine? No. Like, I don't think you have to have it. But if you want to add something to your skincare, which will give you some hydration and additional benefits, snail mucin is a good option that way.
So you suggest a AM PM routine for us? You said you should not do 10 steps, and looking at social media everywhere, the 10 nahi, so at least 5-6 steps to dikhate hain. If I just open any skin blogger or somebody skin content creator, I'll not say blogger, and they will be showing first apply mist toner, and then you have to apply serum, 1 serum of layer, then 2 serum of layer, then AHA, then BHA, and you don't understand what are those.
So it's really confusing, because I think
absolutely it's very, very confusing.
I agree. I can see how that would be very confusing. I feel like sometimes, now that you mention it, if you even go back to their page a week later, they'll show you 10 other products they're using.
Agree.
Right?
Right.
So if you ask me for a general routine, what should essentially be in your routine? One is your cleanser according to your skin type.
Right.
Right? Second is a moisturizer. I prefer a gel-based moisturizer because, like you said, there are other serums we add. So even if the skin is normal to dry, when you add some serum along with a gel-based moisturizer, it's usually sufficient, unless the skin is very dry. And then a sunscreen. for the morning time. Sunscreen ideally should be reapplied after 2 to 3 hours. But a
Right.
lot of times that's not possible because we leave for work or it's just very difficult. That's okay. But ideally, yes, it should be reapplied. Evening time, double cleansing is fine. If you wear makeup, you have sunscreen, you have skincare, double cleansing कर सकते हो. उसके साथ you can choose an active ingredient. For example, अगर exfoliation चाहिए होता है, so some glycolic acid is also generally works for most skin types.
Okay.
And moisturizer again. If you're in your 20s onwards, ideally some retinol or anti-aging can also start. But this is all you need. You don't need many things. बहुत सारे products नहीं चाहिए. एक morning का serum जैसे niacinamide or vitamin C just for some antioxidant brightening action. And evening time exfoliation and anti-aging. That's it.
So we can use exfoliating serum on daily basis.
Preferably not on a daily basis, but 2 days or even 3 days, depending on concentration in the week, is fine. 2 days is ideal.
And you said retinols, but I've heard that retinols don't suit everyone. Is it?
Ideally, honestly, if you ask me as a dermatologist, I would anyways recommend that you should have a consult with a derm and build up your routine, and then you get a general idea of how you want your routine to be, what products suit you, आपको क्या ठीक लगता है अपने लिए, and then you can kind of keep going with that. But so you're right, retinol doesn't suit everyone, but technically, retinoids should be under prescription anyways, like with a doctor and doctor guided.
Yeah, I think this social media and every other brand making all these retinols and AHAs and BHAs, that we tend to get too
Carried
much
away.
confused, and a lot of information is also not good. I think that
I
is
think
what,
so
yeah.
too, because what ends up happening is I've seen a lot of patients come with so many products. They've been gifted some samples of some, they've ordered some. They're so confused. उनको पता ही नहीं है क्या use करना है क्या नहीं करना है. पूरा face भी जला के आ जाते हैं कभी-कभी, like irritate हो जाता है skin. So it's always better to take some advice. But yeah, once again, on the topic of a retinol or retinoid, they can be drying, they can be irritating to the skin. If you want to start without guidance, once to even twice a week is a good point to start. And then you can gradually increase if it's suiting you.
As you mentioned कि जला के आ जाते हैं, I also went. So मेरा face wash खत्म हो गया था, and I got some face wash in the PR package. मैंने check नहीं करा कौन सा है, तो मैंने निकाला and I used. In the second day, my whole face was red and it started flaking because I have a very dry and sensitive skin. And after all that happened, I checked, it was a high concentration salicylic acid face wash, so that did. And उसके बाद मतलब वो यूज करने के ऊपर मुझे इतना ज़्यादा खर्चा करना पड़ा है कि आई वेंट टू डर्मेटोलॉजिस्ट एंड उसने इतना सारा क्रीम्स दिया, फिर शी डिड सम हाइड्रेशन एंड एवरीथिंग टू सेटल दैट आउट. And this was my first encounter with the jalawa gai, and the second encounter was retinol. I used retinol on regular basis for 3 days, and again that same happened. And then she said, "You don't use anything. That's better. You have very sensitive skin." So better. So I'm using Cetaphil ka gentle moisturizer and Bioderma ka thick moisturizer. I think these two I use and I think I'm sorted. And what else you want to suggest me now?
Yeah, so you're the perfect example of someone that has kind of experimented with skincare and ended up spending more money trying to fix it. And that is exactly what I'm trying to say, that may not be for everyone, but agar skin bahut sensitive hai, so it's always better to take some guidance and just understand that what would work and what wouldn't. And back to your question about what would suit you, peptides are great. So of course we should add some anti-aging. So peptides usually don't irritate the skin. They'll provide some hydration as well, depending on the formulation, as well as anti-aging. So that would give you a lot of benefits. Niacinamide also. Niacinamide tends to suit most people. It's not irritative. It has a lot of anti-aging, brightening benefits as well. So 2 things that you could incorporate into your routine along with the gentle cleanser and the moisturizer.
So after that, I'll write a prescription for you. So now let's talk about in-clinic expensive procedures.
Yeah.
I have to mention that expensive because they are super expensive.
Right. Which is relative, but okay.
Yeah. So what's your take on vampire facial, Hollywood facial, hypho, and please tell us.
So honestly, if you ask me about the expense factor, these are procedures that will help you probably lifelong, right? As if you're doing any procedure that's stimulating collagen, that will help you keep looking youthful over the years. Of course, you do have to repeat the procedures, not that you do it once and expect to look young forever.
Yeah.
But then again, you bring in the factor of skincare. I've realized people are spending so much on skincare right now. If you actually add up all the products you have,
Yeah, right.
you
Agree.
could, in a period of month, I've heard of people spending anywhere from 10 to 20,000 as well, which
Agree.
add aya, discount mila,
हाँ.
to le liya. Right? So I would say that rather than that, up apna basic skincare rakho, and along with that, some one in-clinic procedure every month. And there are procedures of all ranges. So vampire facials, usually within a decent budget.
Okay.
It just all we have to do here is we take the blood sample, take out concentrated platelets, inject them into the face. If you're someone a little scared of injections, they can be microneedled. So it's done with numbing cream. So when you do microneedling with the PRP, you actually don't feel any pain or sensation like that, but it would stimulate collagen. It would help with glowing skin, evening out the skin tone. And even if there are any like enlarged pores or acne scars, it would help with that too.
So after what age you advise all these procedures?
Honestly, our collagen production is the best in our 20s.
Okay.
So there's a misconception that if you're in your 20s, you're too young to get anything done. I actually think it's the other way around, that when we start a little bit, I'm not saying that every month come in and do a vampire facial in your 20s, but if you start a bit in your 20s, it actually helps to stimulate collagen, which is the best in our 20s. And that would also help you in the long run, because anti-aging is exactly that, right? It's anti-aging. Aging ho gaya to usko hum reverse nahi kar rahe. We're trying to slow down the aging. And aging is starting in our 20s.
But I think nobody wakes up in 20s, and once they are in their 30s or late 30s, when they start getting wrinkles, that's when they are awake. So what should we
I also think that's very subjective again. That I've seen people I've had people in 40s and 50s and come say, doctor, hum retinol क्यों use करें, हम young नहीं है इसलिए, anti aging है तो हम तो काफी young है. And they mean it, they'll be like, I'm too young for anti aging. So I think it's very subjective and relative, and it's more about how you feel. जैसे कुछ लोगों को बिल्कुल bother ही नहीं करता. There are people in their 60s and 70s who are very happy with the way they look.
Right.
They're fine with wrinkles, sagging skin, or maybe they don't have so many wrinkles compared to their friends, so they think they look very good.
Yeah,
right? So I think it's very subjective, but medically speaking, collagen production is the best in your 20s. So if you can start, then great. Late 20s is a good time to start thinking about it. If you're in your 30s, vampire facial is a great way to start, because it's something like your own blood, nothing external. So this is a good option. HIFU is a great option because, again, non-invasive, usme koi injections nahi hota. It's just a type of ultrasound technology for lifting and tightening.
Right.
So that's a great option too. If you're up for it, fillers also, again, great, because jitna aap jaldi start karoge, utna aap usko thoda sa अच्छे से maintain कर सकते हो. Or jitna aap late कर रहे हो, तो फिर there's a limit to how much can be corrected.
So, but fillers, everybody is very scared of fillers. And it's not just about injections. It's about, I think everybody is scared of fillers. Why it's so? And what's we actually do with fillers, and who all we need that?
So what happens with fillers? I think the reason people are getting more and more skeptical about it.
Yes.
You have two types of people: the ones that are completely open to it.
Yeah, right.
They understand what it does and they're happy to get it done. And there's more of that population now.
Right.
Then you have the ones that are completely opposed to it, because probably they don't even know enough about it, but they've been watching TV, they see celebrities, they think the faces are looking so unnatural, which to some extent is true as well. But I think, again, this is subjective, right? Because either A, their injector has not done a good job, or B, that celebrity wants that. We kind of don't realize that there is a personal opinion and a personal choice also when a treatment is done. So if a patient is saying, I want bigger lips, many times the doctor may oblige. I personally, agar mujhe bahut unrealistic lagta hai, if I feel this would not suit a person's face, I do share my professional advice and I advise against it, because mujhe aise lagta hai ye janam mujhe represent karta hai, and they represent me when they're walking around with those big lips. And if someone asks them who did it, so I do think that your injector and your personal choice plays a role to how you look. And your question about who needs a filler, I think fillers have been such a game changer, right? एक टाइम होता था जब बहुत छोटा लिप होगा, आप स्माइल भी करोगे, लिप तो बिल्कुल चले जाता है, लिपस्टिक भी दांतों पे लग जाएगी बिकॉज लिप्स इतने पतले हैं,
राइट।
राइट? बट नाउ इमेजिन आप उसको हल्का सा अगर प्लम्प करते हो, no one will realize as well that they're plumping. They'll just make you feel more confident. बहुत लोग conscious होते हैं dark circles के लिए, like which is a lot of times because of hollowness of eyes. So as we're aging, as we're gaining, losing weight, eyes बहुत hollow दिखने लगती हैं, and उसको हम filler के साथ treat कर सकते हैं, and that really improves a person's confidence.
So there's one thing is fillers and another thing is Botox. And I think that वो एकदम stretchy feel and when you smile, you don't even get smile lines and everything. That comes with Botox, right?
You know, actually, that's a great question. So, इसमें बहुत taboo है and misconception है. So again, patients बहुत time आके बोलेंगे हमें filler Botox नहीं चाहिए. They think filler and Botox is the same, but it's actually not. Filler is hyaluronic acid, which is a gel used for either plumping, enhancing, filling, or lifting a place, right? Whereas Botox is a type of toxin जो हमारे muscle को relax कर देता है. So जब हम गुस्सा करते हैं, हम ये frown lines बनाते हैं, वो बहुत deep होने लगती हैं, and over time हमें realize नहीं होता है. जो जिससे हम बात करते हैं, उनको दिखता है कि ये तो बहुत गुस्से में लग रहा है, या you know, eyes are looking very stressed, exactly like yours.
बहुत ज़्यादा I need Botox.
Yeah. No, I mean, it's again a personal choice, but yes, so वो relax हो जाता है, and it helps to prevent permanent lines. So जब हम mirror में देखते हैं, हमें नहीं दिखता है. But जब हम अपना video देखेंगे किसी से बात करते हुए, or if you know we're expressing, we'll realize that वहाँ पे lines बहुत हैं, like frown lines, forehead lines, crow's feet. So Botox उसको relax करता है. So it helps you look younger. This is a misconception. वो आपको freeze नहीं करता है.
Then what caused freeziness? Because like if you have seen Jitendra very recently, he has matlab, if he'll smile, there are no smile lines are coming. So same with Aishwarya Rai back days, thode time pehle, uh, her face was also like that. But too much stretchy, and whenever they smile, the smile lines also don't come.
So if the forehead, eyes, and this area are looking very frozen, that can be the Botox. So maybe the dosage is high, or you know that person wants a completely tight appearance where those expressions are not showing. But in terms of the cheeks and the smile lines, probably they may be overfilled. So when the filler is a lot, we also have to keep in mind that these are very old, like Jitendra is very old, right? So in the sense that he is probably what, 70s now, I'm assuming.
Right.
So there's a possibility he may have done surgical treatment too, right? We don't know exactly what he's done, but a lot of times the celebrities जो हमें दिखते हैं, उन्होंने probably surgical treatments along with other aesthetic procedures किए हुए हैं, जिससे वो बहुत ज़्यादा लगने लगता है.
So maybe mixture of Botox and fillers.
Botox fillers and probably like surgical facelifts and things like that as well, which makes the skin look very tight and lifted along with the injectables. Nothing wrong with doing a facelift either, but sometimes it's just been overdone, or you know, so that could make it look like too much.
There's another procedure in which you
thread
do
lift.
thread lift. So you put thread inside?
Yes, it's like a type of almost an advanced type of suture material. You can consider it that way. So वो thread डाल के lift होता है face. It's a non-surgical OPD procedure. You can actually get it done in 1 hour and you're good to go.
You said 1 hour, but it's scary.
It seems scary, but it's not off. It's not bad. It's literally with just a little bit of local anesthesia, and you just.
So you must be doing local anesthesia, not just topical.
You can use topical along with local, or you could just do some local anesthesia. But there's no general anesthesia. It's just insulin syringes for the anesthesia, which is a very small prick. Not terrible.
It seems terrible for everyone.
Yeah.
So you told us about two injectables. One is Botox, another is filler. What else injectables are these days very in?
That's a good question. So we have like a lot of new things coming up now: PDRN, exosomes, skin boosters, skin weave. So these are great for skin quality. So, you know, there was a time when we wanted to just lift or treat the wrinkles, but now because younger generations are also taking good care of their skin, so their motive is not just to kind of treat the wrinkles or lift the face, they also want good skin quality. Right. So they don't just want to rely on makeup, right? So skin boosters help to improve the skin quality, hydration, the suppleness, the stretch of the skin. and even collagen induction. So these are really good procedures
Yeah,
too.
I got the skin booster done also.
Yeah.
I've done everything. It seems like. So my skin was a Thar desert. Matlab, literally Thar desert. Whatever I apply, even if I'm applying a good oil, the kumkumadi oil I used to apply because I needed a hydration. And then I apply foundation or something. That time also it used to crack. It was that dry. And then my dermac, she suggested me to go for skin boosters. But that's an expensive procedure and the effect lasts not much.
So what I feel is
Hmm.
the product being used is very important.
Okay.
The quantity being used is very important. And it lasts you initially, what I feel, after 3 to 6 months, when you top it up,
Yeah.
you
I
get a
have
longer lasting result.
okay,
So
मैंने top up नहीं करा.
ideally, theoretically, it's said that skin boosters last 9 months. But what I feel is if you do it at 3 to 6 months, you find better results. So it just kind of keeps building up and the hydration levels improve. So, for example, the one product I love is Skin Weave. This
Okay.
actually is scientifically proven to increase collagen as well as aquaporin 3, which will hydrate the skin. So it increases the hydration molecules in our skin. So even after the product is washing away, the
Right.
hydration should stay good. But then it's always a good idea to top it up.
Yeah, I think I've never topped it up. I think that's maybe because I thought कि around 6 months के बाद.
6 months is ideal.
6 months
But if
is
you're
okay.
very, very dry and अगर आपको उसका effect अच्छा लगा and आपको उसको top up करना है, then you can do it after 3-4 months.
So मुझे उसका इफेक्ट ऐसा लगा कि earlier I literally used to apply a lot of oils to keep my face hydrated so that whenever I'm smiling or doing something, it doesn't feel stretchy to over places. But then after that, a normal moisturizer can also do the work.
Yeah, which
So
is a big deal, right?
yeah,
Because
yeah,
अब
right.
आपने procedure कराया, but now you don't have to use any kind of oils or any kind of products on
Correct.
top. Just a basic moisturizer,
Yeah.
which helps in terms of convenience and time saving as
Yes,
well.
right.
Time is money.
Agree. Now let's talk about time is money. Then I think सबसे ज़्यादा money is with the hair removals. सबसे ज़्यादा time taking and also money taking because every 20 days you need to go and get your hair removal done with waxing or something. So how safe are those hair removal lasers?
So, hair removal laser also has varieties, different types of lasers.
Okay.
If I speak personally at my clinic, we have a US FDA approved device, which is actually German. It's great. It's pretty painless compared to the other devices. So I do think it depends on the device being used.
Okay.
But the concept is they target the hair follicles. So I know there are a lot of myths related to hair removal lasers that your skin will get burned, it'll cause cancer.
Cancer.
Yeah, but this is not true, right? So it
Okay.
should be a good laser. It's designed to target the hair follicles and not your skin. But a lot of people don't understand this. They're getting the home services from salons or certain online platforms. Obviously, that is not doctor guided. Neither will they send like a good expensive machine home. They're going to give you the Chinese Korean machines, which may not be well researched. Neither do they have any kind of FDA approvals. So those would lead to some complications. A lot of times the technicians also doing it may not be well experienced, and that's where the burns and complications happen. So it's always a good idea to do this under doctor's guidance with an experienced therapist.
Yeah. And why it's that the laser only works on darker hairs and not work on lighter hair?
So traditionally we use the diode laser, and that is designed to target pigment which is at the base of our hair follicle, and that's how it burns the hair as well.
Okay.
So if the hair is very light, the pigment is also very light, and it's very difficult then to target the hair because it's almost indirectly burning the hair as well.
Yeah, I got it. So again, I have also got the full body laser done, but I am very, very scared about my face. And like every day I see reels and everything that if you'll get the razor done, because लेजर से पहले तो रेजर से ही रिमूव करेंगे एंड रेजर डन तो थिक हेयर आ जाते हैं थिक हेयर नहीं आएंगे दैट्स व्हाट एवरीबॉडी सेज बट स्टिल दैट थिंग इज देयर इन मी What if thick hair aa gaye to?
You're right, but I think on the face in women, anyways, if there's thick hair coming, we have to look at the hormonal factor as well. So a lot of
Hmm.
times people just want to blame, like the shaving or some other thing, but it's usually something related to hormones. Secondly, when we're shaving, we're just cutting the hair on the top of the skin surface. We're not actually targeting anything in the roots. We're not impacting the roots. So it doesn't make sense that the hair would get thicker, but I think that illusion is created because when you shave, the hair feels harder
Harder,
on the
right?
surface. But if you let it grow out, it goes back to being thin again.
I mean, and once we get that hair laser done on the face, after that also it will not be coming thicker
So there
because
is,
again the pigment is very light over here.
it depends, right? So I've seen women that have proper like stubble like hair growth where
Okay,
it's very hard, very thick. For them, laser has been life changing.
right.
It is mentally disturbing at times to have so much facial hair that you're shaving on a daily basis. Even after shaving, the greenish or grayish tinges there, pigmentation is there.
Agree.
So
Yeah.
if in your case the hair is very light, very fine, you can probably get away without doing the laser anyways, right? Like, so this becomes a very personal choice of whether you want to do laser or not. But if it's someone who has very thick hair, they're shaving every day or even once a week, that's quite frequent and that's pretty stressful and it's an additional job. And like I said, time is money, right?
Yeah, that green patch comes. I have seen a lot of girls also having that green patch. Why it is because is it because of
It's
their
just the thick hair, the follicles, the kind of maybe the hair under the surface as well. So it kind of creates a greenish tinge to the skin.
but it feels more like a masculine type of beard, right?
Yeah.
I know I'm talking a little gross, but yeah, it looks like that. So
It
that is what I was scared of.
it does, you're right, but and that is again hormonal, right? So there usually when there's some hormonal fluctuation, if there's any PCOD, if there's an increase in testosterone levels, so that stimulates the beard area or this facial hair,
Right.
similar to how when boys are going through puberty, testosterone increases and they start growing a beard.
I think for me, a Q switch works best.
Yeah,
Q
yeah,
switch
yeah,
that
it
helps.
does, it does, it
Yeah,
does.
so that's what I do rather than going for bleaches. I get that Q switch done, and it lightens the hair and
You're right.
work
That's
is fine.
actually a great option. So Q switch
Yeah,
helps to brighten up the skin tone and it kind of bleaches the hair at the same time. So it solves both
solves both of them.
purposes. Yeah.
That way we are sorted. Now let's come on hair. Hair fall is so common after kids. In ladies especially, मतलब इतना hair fall होता है कि they started having bald patches. What can be done?
That's again a great question. We have to understand that when a woman goes through a pregnancy, there's a sudden increase in hormones, and then
Yeah,
after the delivery, over time, there's a
sudden
sudden
growth.
drop in the estrogen as well.
Yes.
There's a stress related to even just having a baby at home, sleepless nights, irregular eating habits. Then maybe any kind of deficiencies because of due to the lactation, the stress of the lactation as well.
Yeah, right.
Feeding is its own, it is disturbing in
It
the
is,
initial
yeah.
times when if you don't know how to do it or if there are issues with baby latching, so many problems are there. So I think it's a cumulative effect of many things. It's not just hormones, but it's a little bit of stress, a little bit of dietary factor, a little bit of any kind of deficiencies. So I think we have to again realize we need to look at this holistically,
Mhm.
right? So giving support to the mother, or if you are the mother, getting support wherever you can.
Right.
um, just improving the diet, making sure you can consult a nutritionist to make sure you're getting enough protein, enough vitamins. Don't stop supplementation. I think most of us have this habit. The minute the delivery happens, we all get
We
lazy.
stop
We
behind.
stop the vitamins. We stop everything. We may not be meeting our gynecologist as regularly. So that's important. And along with that, peptide-based hair growth serums work great.
Oh.
PRP, GFC, QR678 are great procedures. They help to slow down the fall as well as improve the growth of the hair.
So that's again a clinical procedures.
Clinical procedures, because you have to realize that the hair is, you've lost hair, the hair is looking thin, scalp may be visible, which means a significant amount of losses happen. So it's better to treat it aggressively rather than just kind of,
Yeah.
wait and watch.
And what's your take on hair growth oils?
I'm not a
And
big fan of.
shampoos also.
So, okay, shampoos are a bit of a marketing gimmick. Shampoo cannot stop your hair fall, but yes, using milder sulfate paraben free shampoo if you have dry hair could help, because when the hair is dry, then it falls more, it'll break more. In terms of oils, I'm not a fan of oils per se. I think that many people, especially in an Indian environment, जहाँ पे humidity होती है, गर्मी होती है, sweating होती है, तो oil से वो और problem हो जाता है. Sometimes दाने आ जाते हैं, itching होता है, dandruff हो जाता है. So in that sense, I think hair growth serums, which are formulated are like well and are light on the scalp, वो अच्छा रहता है because उसमें active ingredient होता है, but बहुत thick नहीं होता है, so उससे better होता है.
You
So
said
that's a good.
dandruff. Oils, dandruff? What's the relation?
Yeah, so actually, dandruff is a layman term for usually seborrheic dermatitis. Seborrheic dermatitis is, um, it's almost a type of fungus which is naturally there on our scalp, जो oil पे feed करता है. So जब हमारा scalp oily होता है, वो उसको feed करेगा. So अगर हम ऊपर से भी oil डालेंगे, वो और aggravate होगा. So it's important to keep the scalp clean as well.
But the dandruff feels very dry
Flaky and
already.
dry.
Yeah.
Yeah, it feels that way. It could even be something else. There are other conditions like SIBO psoriasis, just में flaking hota hai, winter time में aggravate hota hai. But most times the like seborrheic dermatitis, also referred to as dandruff, is usually related to the oily scalp as well. So you'll realize that if you even cleanse regularly, the dandruff also does improve.
And these days, biotin tablets are very common. How they does they help in hair fall?
Biotin has a role in keratin production, and keratin is a part of our hair, of course. It's what our hair is made up of. So, yes, to some extent, but I don't think that it's like life changing. जैसे लोग बोलते हैं कि biotin tablet start कर दी तो बस hair fall बंद हो जाएगा, ऐसा नहीं होता है. Biotin deficiency भी बहुत कम लोगों में होती है. It's very uncommon actually. It's not a common deficiency to have. So sometimes ऐसे भी हो सकता है biotin supplements में और भी vitamins होते हैं. So maybe because of that it helps too. But the scientific evidence for biotin alone is not that much.
So it can just help aid, but not alone. It will be too much helpful.
It's not a monotherapy.
No, तो मतलब तभी मैं खुद भी I have literally eaten the full boxes thinking that it will help my hair. मतलब I don't remember now it helped or not.
Yeah, I was gonna ask you, did it?
Yeah, it did.
Yeah.
Agree.
Yeah.
So yeah, it don't help too much.
Yeah. So yeah, I mean, I think it's again like everything in our body, whether it's skin, hair, it's usually a combination of things, right? So we need a more holistic approach.
So we need more of everything. The proper nutrition and protein intake is what helps.
Yes.
So there is no one shot supplement that can help in hair growth. There are a lot of clinics also there who are selling these supplements, hair growth supplements, and with their own branding and everything.
There's nothing wrong with the hair growth supplements, because our hair, like I said, it's not just biotin, right? Usme minerals bhi hote hain, और भी vitamins hote hain, protein bhi plays a role. So they do help. It's not like they don't help. I also think we're not able to get that much nutrition out of our diet these days.
Yeah.
How much can we eat? How many greens and different colored fruits, veggies are we able to eat in the day? So supplements do help, but biotin alone may not be enough.
The supplements can help, but just stop that is not going to help.
Yeah, and I also think right now, because of social media and like Google and whatnot, and all this advertisements, websites selling products, people are self-medicating. तो वो नहीं करना है. Like if अगर आप vitamin ले रहे हो, थोड़ा सा with a kind of with an intention, we should take the vitamin. After checking proper blood tests, we should take the vitamins, not just for the sake of taking the vitamin because someone said it'll help stop the hair loss.
Yeah, you're right. And there's another word called city related hair fall, that when we change city, and because that city has hard water, we start saying that we are getting so much of hair fall. Does hard water, or if that helps in
Yes
that is
and
the
no.
reason for hair fall?
Yes and no. It can kind of aggravate the hair fall. It can cause some hair loss where build up ho jata hai, dryness hoti hai hair ki because of the hard water. There are water softeners these days available जो आप tap के ऊपर लगा सकते हो to help soften the water and just make it milder and a little skin and hair friendly. But it won't be the only cause. It's not the only cause for hair fall. It can definitely aggravate the hair fall, but I don't think it would be
I
the
think
only.
we should see on more holistic way, nutrition, supplementation, oiling, shampoo, hard water, सब कुछ देखना है.
सब कुछ देखना है. A lot of times हमें ये भी सोचना होता है अगर कोई city में आया है, they've changed locations.
Yeah.
If you actually go deeper, you'll realize उनको भी stress हो रहा है कहीं ना कहीं. वो new shift हुए हैं, job change हुआ है, lifestyle change हुआ है, diet change हुआ है. So उसमें भी वो like factor होता है. So when you actually talk to the patient, so I like to take my time with my patients. I like to discuss, and you'll realize there's so much more to it than just water change.
Yeah, I think that makes a lot of sense because we start blaming only the one thing, what we are
Yeah.
using or what has changed just now, rather than taking into a holistically. Thank you so much, Dr.
Thank you.
Anicka. It was great talking to you, and
Thank
I've
you. It's
realized, and
great
now
being
I'm
here.
getting one paper for my prescription.
Sure, my pleasure.
Thank you so much.
Thank you. Thank you for having me.